Welcome to Deuk Spine Institute, watching live spine surgery. Today our patient comes from Canada. He just had 4 discs repaired with our Deuk laser disc repair to treat his back pain he's had for 3 years. Now we're going to focus on his piriformis muscle, which is torn. It will never heal itself. It'll just continue to cause buttock pain like a Charlie horse in the top of your buttock. And we're going to go in and we're going to do a release, which will take 5 minutes. And that will be a permanent fix to his buttock pain. To do the release, we have to identify the greater trochanter, which is the top of the hip shot, and I have to basically release the tendon off of the top of the hip, right there. All right, Henry, let's show the audience what it is we're talking about.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. We have just completed the piriformis release on this patient's right side, and you can see from the video that we're basically cutting a damaged muscle fibers and releasing the muscle tension so that the muscle will heal. The muscle will never heal on its own, because as long as people get up and walk around and do things, you're going to keep re-tearing the tear. So 4mm incision, we just released the piriformis muscle, which is the only permanent treatment of piriformis syndrome in the world. There is no other treatment that works, and we pioneered this treatment here at Deuk Spine. If you go anywhere else in the world for piriformis, watch out for the needle. Let me have the marker. If you go anywhere else, the way that doctors do the piriformis release, this is the butt cheek here, right? They're going to make a cut like this, right in your gluteus maximus. They're literally going to cut the muscle right in half to find the piriformis way down below. And then the sciatic nerve is there. You can damage the sciatic nerve, blood vessels. But I pioneered a brand new way of doing it, which is patented now in the United States. And I basically release the muscle in a safe area off the top of the hip. There is no bleeding. There is no minimal to no pain afterwards. And there is no risk of damaging the sciatic nerve or blood vessels or other muscles. And it's outpatient, and it works literally 100% of curing that pain. So thanks for joining us. Any questions?
Yes, we have a question and a comment. The question's coming from Kit on YouTube, asking what is the email for medical records?
The email for medical records, I don't know the answer to that. You need to probably call the office and ask. Great question.
And then we have a comment coming from Max on Facebook saying, I have pain, I cannot move, I feel dizzy, nauseous, neck and back. Sometimes I lose coordination and I have just rest to get better. Oh well.
Well, come and get fixed here. We can help you at Deuk Spine. That's why we do these videos, so people can learn that they're helpable. We can get rid of your pain for you, but you have to come here and get it done. I would recommend doing the free MRI review. It costs you no money. All you got to do is send us your images of your MRI along with the report, and you get a 10-minute consultation all for free. This is a $1,000 value you're getting for free, and you get a diagnosis, and you'll get a treatment plan. So hopefully you'll take advantage of that.
And that is it for comments and questions.
Wonderful. All right, thanks for joining us. We'll be back next week on Tuesday.